Hola a todas y a todos, bienvenidos a este proyecto de difusión sobre la terapia Gestalt con perspectiva de campo. Yo soy Dani Mora, quien les acompaña, y por supuesto hoy traigo para ustedes una nueva entrevista. El tópico de hoy será la construcción de los cuerpos y sus sufrimientos, aspectos culturales, relacionales y biológicos. Para esto nos va a estar acompañando desde Italia Michela Gecele. Ella es psiquiatra y terapeuta gestáltica, es formadora y supervisora internacional, ha publicado libros, artículos y capítulos sobre temas de psicoterapia y psicopatología, explorando el sufrimiento clínico y sus experiencias de ajuste creativo desde un punto de vista fenomenológico y de terapia Gestalt. Otro tema de investigación y estudio clínico es el de las cuestiones interculturales. Por otro lado, ha trabajado desde años en servicios públicos de salud mental, también como supervisora, y durante 3 años ha coordinado en Turín un servicio psicológico y psiquiátrico para inmigrantes y es supervisora de servicios públicos de salud mental y de programas para inmigrantes. Asimismo, es miembro del Instituto de Terapia Gestalt de Nueva York y de la Comisión de Derechos Humanos y Responsabilidad Social de la Asociación Europea de Terapia Gestalt. También es codirectora del Instituto Internacional de Terapia Gestalt y Psicopatología. Michela Gecele trabaja y vive entre Catania y Turín. Entonces vamos a reflexionar juntos sobre la temática relacionada con la construcción de los cuerpos y sus sufrimientos. Cuando hablamos de sufrimientos, ¿a qué nos referimos? Estos y otros temas vamos a tener la posibilidad de discutirlos en conjunto con esta gran autora muy importante para la Gestalt contemporánea. Así que, como siempre, disfruten de esta entrevista. Para mí es un honor estar aquí en este espacio y compartirlo con una de las grandes autoras a quien admiro muchísimo, Michela Gecele. Gracias por estar aquí, gracias por compartir con nosotros todo lo que está dispuesta a compartir. Y bueno, quiero preguntarle principalmente cómo está hoy, en este momento.
Okay. I'm sorry not to speak Spanish. I would like to, but I can do a bit, but it's not. So I'm okay. I'm glad to be here too, to know you. I like the way you are doing this kind of video, and yes, I like it. Your idea, your way of doing it. Okay.
Y bueno, hoy tenemos una temática muy importantísima que es la construcción de los cuerpos y sus sufrimientos, aspectos culturales, relacionales y biológicos. Entonces, ¿le parece si comenzamos con las preguntas?
¿Sí? Bien.
Ok, perfecto. Entonces, una pregunta
it's difficult to speak English when you speak Spanish. It's easier to speak Italian. It's more automatic.
Yes. Bueno, hay una pregunta muy amplia en este momento que le voy a hacer, por supuesto, y es ¿cómo influye la fenomenología en su comprensión y aplicación clínica de la terapia Gestalt?
I'm answering in a simple way, at least first of all. So I would say that it is not influencing so much my way of understanding Gestalt therapy in general. What it is influencing very much is my way to understand psychopathology in Gestalt therapy. Because in general, Gestalt psychotherapy, of course, it is itself influenced by phenomenology. So we are already inside phenomenology when we work with Gestalt therapy, but something more coming from phenomenology is when I work with psychopathology, when I theorize working with psychopathology, when we do clinical work, when we do supervision, that is very present. Also because of my psychiatric side, which is phenomenological psychiatric side.
Hay otra cosa para mí también importante y es nombrar que su último libro lleva por título La otredad en un mundo fragmentado, la psicoterapia en la sociedad contemporánea. Frente a esto, ¿cómo define la otredad en el contexto de la sociedad contemporánea y qué factores han contribuido a la fragmentación del mundo actual?
I think we will start from the second part.
Okay. Perfect.
our, and of course, when I say our, I have always in mind mostly Gianni Franceschetti and sometimes also Jan Robau. So it is a we, which is sometimes a two-person, sometimes it is three-person. That is in general.
Mhm.
And so we consider very much both the developing of psychotherapy, I mean, in general psychotherapy, not only Gestalt therapy, and the developing of psychopathology, very much connected with social changes, in the history of humankind, I would say. So different places, different period, and so on. If we start from Lasch, in the end of the 70s, he used to speak or started to speak of culture of narcissism. So that period was the period of a kind of narcissistic society, which, by the way, started very earlier. Also, when Gestalt therapy started in the 50s, it was becoming the single person and even before, I would say, the single person was becoming, in a way, more important than society, more and more progressively. So, in a way, in Freud time, society was more important than individual. And we know by what his writings a lot about that. And then this started to changing. So it was more, or at least it was less and less, that a person had to adapt to the situation, but create their own life. So that is, this kind of narcissistic society in which Kohut would say, would speak of tragic men, in which the person has his own destiny in their end. So and so there is a lot about reaching success, reaching power, or at least fulfillment in our life. And that was becoming more and more and more. And at the beginning was a kind of liberation, becoming more free from conditioning of society. But, the more you go into a narcissistic experience, the more you are alone. And so in the end, if we become more and more individual, more individualistic, with less connection, with less bonds, it's as if we are all a kind of island, and there is nothing between us. So that is about this kind of, in last decades, many authors speak of that. And Bauman, for example, speaks of liquid society, which is quite similar. And we use this idea of fragmented society, which is this island without in between, without connection. So that is the first part of the answer. So in such a fragmented society, what is becoming more and more difficult is to connect. It's not anymore to perform, to be the best one or whatever, but what is difficult is to connect. And so here I turn to the first part of your answer. In a way, otherness is very much otherness. It's not something that I can understand because it's already part of myself. It's already connected. It's already in the in-between. It's as if the other is very far. It's very other. So what is but that's exactly why it is so important to speak of otherness and to try to find this connection, because we know that if we compare narcissistic society with narcissistic personality dimension, we know that there is a kind of lack of empathy, which is not lacking of feeling, but lack of empathy in the meaning of understanding in what way I can influence the other, in what way what I do, what I feel is taken by the other, in what way we are moved together, we are connected. And so that is why it's so important to try to make sense of that. Okay, may I just add one thing about that? Sorry,
Yes.
because as you mentioned my book, and you translated into Spanish the English title, but this book was first published in Italian, and the Italian title is different. So we had a discussion with the English publisher and we changed the title.
Okay.
But in Italian, the title is The Backgrounds of Alterity, or The Backgrounds of the Otherness. So it is much more connected with also with Gestalt theory. So what is lacking in a way, what is missing is the background, is the connecting background. That is the meaning about all the book and about the difficulty with meeting the otherness.
Importante e interesante. Por eso no quería dejar de nombrar esto porque creo que es una introducción para todo lo que vamos a hablar hoy, ¿cierto? Podemos pasar a la siguiente pregunta, que es la más importante y es, desde una perspectiva gestáltica, ¿cómo se entiende el proceso de construcción de los cuerpos y sus sufrimientos? ¿Qué factores influyen o condicionan este proceso?
When you say from the Gestalt therapy point of view, I would give you the same answer that I give to our trainees when they ask us, what Gestalt therapy says about that? And usually both Gianni and me, we answer, it's not so much that Gestalt therapy says that, is that we are taking all what is around us, all the theory also from other approaches, other disciplines, but we are putting them inside a Gestalt way of working and of dealing with human things. So that is the first first part. And yes, by the way, I had a kind of a master in cultural anthropology, so I've been working very much with immigrants, and so I'm very much interested in the cultural side also of psychopathology or relationship and so on. But in last years, what I'm very much working with is also this part about the body, because for very many reasons. So here probably I'm making myself a question and answering, because I'm not exactly answering what you were saying. In a way, I'm dealing very much with the body for different reasons. From one side, because in psychopathology, we meet more and more some problems, some difficulty with our own body. There is a lot, for example, in panic attacks, but also in phobic symptoms, but also in anxiety symptoms. In many situations, what we observe, what we feel, what we live when we are in session or we are doing supervision is that the body is a kind of other, is a kind of stranger for many people nowadays. So I remember the old question in Gestalt therapy when I was taught, it was many decades ago, in the ancient time, in prehistoric times, I was I was taught, the first question is, how do you feel? And nowadays, many times, if we ask to somebody, how do you feel? They don't even understand the question, because they are not used to stay in the body. Mm-hmm. And so that's why it's so important for me to work also with the body and with the connection between. Of course, in Gestalt therapy we don't say between, because they are all together, body and mind and relationship. But just to understand the language is like that. So we have to divide things to understand each other. So nowadays, to work with psychopathology means to work a lot with the body, more than before. Even if we know that in the session the body is present because of the feeling, because of the intercorporeity, but the body is very much present about the way of people suffer in psychopathology. So that's one point why I'm very much interested in the body. because there is a lot about supporting personality function, for sure. Narration, memory are so lacking in this fragmented society, but also the body is fragmented. So also the id function, the body is so important to work with nowadays. So that is why I'm so interested in that. And also because I think, and that is in general, not only in our time, that some psychological, if you want to call it like them, suffering are so embodied, so deeply embodied, that we cannot reach them only with words, only with psychotherapy in a way. Sometimes the body gets ill because of psychological things, because of facts that happen in our life, and so it's important to treat together body and psychological side. So in that way, I'm very fond, for example, of Chinese medicine, because they are working together with this perspective. So there is not this difference between body and psychology, but there is an energy, and everything is working on that energy. So these are the premises in a way. And then maybe I'm going to answer to your question also. So in what is for me very also specific of Gestalt therapy, as we all know, is this holism which is present. So we are used to work together, to consider together body, mind, relationship, society, organism, environment, field perspective. All this is part in field perspective. The body is very much present. Forces of the field are connected with the body a lot. So working with the body is very much part of Gestalt therapy. And also, it is not what is very interesting. Also, if we read the Percephaline Goodman book, Theory and Practice of Gestalt Therapy, they say that. Also in the preface to this book, we notice that the polarization that make our everyday life are not so useful in psychotherapy. And for example, outside and inside, as we know in a field perspective. And the body is exactly that, because one very interesting starting point is that our body, every function of our body, heart beating, pressure, hormones level, and so on, they have a rhythmic level. They are not the same for the whole 24 hour. There is a rhythmic level, and that is connected, this rhythmicity is connected to the day and night, is connected with the outside. So just from this little example, we see how much the so-called inside of the body is actually outside. It's connected very much to the outside, not only through lungs, through breathing, not only through food and digestive system, but also about all our function. They are connected to the outside. So we cannot forget that. And also, I totally didn't answer, I see. And also the body is made by relationship. Because also this rhythmicity itself I was speaking of, it starts in very early childhood in relationship with the caregiver. So it's not that the body starts and has its own reason, but it's part of what is taken, what is produced in the relationship with the caregiver. So the body is produced by relationship, by taking care of a little child. That is at a microscopic level, and at a macroscopic level is society that is making the body, that is suggesting how the voice has to be, how the movements of the body, what illness means, what healthy means, what is the model of the body, what is the right or wrong model. So there is a lot there.
Ahora, tengo una pregunta frente a algo que acaba de decir, y es que nos han formado en un paradigma, por supuesto, individualista. Y dentro de la psicoterapia, la pregunta que generalmente se hace es, ¿cómo te sientes? ¿O cómo sientes eso en tu cuerpo? ¿Mm? ¿Qué opinión, Michela, tienes alrededor de esta pregunta? ¿Y cuál sería la propuesta de la terapia gestáltica de campo ante esta posible exploración, ¿no? Que estamos acostumbrados a situarlo en el individuo, tu cuerpo?
Mm. That's a very interesting question. Thank you. It's a very interesting question, and I don't think I have a precise answer because, of course, it depends on what client, what moment of the therapy, what is the client used to, and so on. So, as you know, no, but it addresses a very important point because. As I said before, once upon a time, that was the main question in Gestalt therapy. But nowadays, it's far less meaningful. And sometimes we can use it anyway because it's a way to have a kind of feedback from the person. No, it's a kind of diagnostic way in a very broad meaning. So if I ask you how do you feel, where are you, what is in your body, and you answer me, I'm orienting myself about what is going on. So for me, it's not so much about what to ask to the client, but it's about our way of thinking and our way of feeling and of dealing with the situation. Because the point is that usually, as I said before, sometimes nowadays some people don't even know what they feel and the body is a stranger. In other situations, they think to feel, they attribute what their experience to their own personal, private, individualistic feeling, and they don't understand that many times our mood, for example, is not starting from something that is happening to us, but from what is in between, what is in the field. So it's more about kind of having ourselves this perspective and trying to bring it in therapy, sometimes in a very soft way, sometimes in a very explicit way. And about that, I give an example because at least here in Italy, it is quite clear. When we were in the COVID period, we and now we is all psychotherapists, is our professional part. We met people who very frequently said, "Oh, I'm so tired. Oh, I don't know why I'm doing little things and I'm very much tired, or I'm depressed. I have no energy at all," and all this. And most of the time, not always, of course, but most of the time, that was not due to some personal experience, to some difficulty in their own private life, but it was because of being part of, in this field in which there was a lot of fear, anguish, low energy, not trusting the future, not know, and this was kind of energy consuming, and the person give the interpretation of that, saying, "I'm depressed." And that is a big example. It's very easy to say about COVID time, but that is happening all the time, every day. People, the people who are more sensitive to what is around, to the fragment of the field, to the background, take the mood, take the feeling from the outside, and take them as it is, as if it were their own. So there is a lot of work to say, okay, that is part of the field, that is part of the social side. It is not you. And so there are different ways to do that. As I said before, you can go little by little and sometimes really very explicit. In COVID time, we used to be very explicit. "Oh, please, it's not you. It's normal. It would be strange not to feel that in this period. It would be abnormal not to feel that." So that's a point to address. And of course, there are situations in which is easier and other situations in which is more difficult to to do that in therapy. By the way, as we are talking about the body, there are a lot of studies, researches that also say how much the body influence each other. So it's not only the mood, abstract mood, but what is happening, the hormones and so on, is as if they are speaking to each other, and we are taking something from other body and taking them inside our body, and we feel it is us. So.
Es todo tan interesante que no sé cómo seguir. Pero lo haré con una pregunta también importante, y es, ¿qué hace que el cuerpo cada vez sea más extraño para nosotros, más ajeno para nosotros?
Yes, you know, that is this kind of polarity we were mentioning now, because from one side we continuously run the risk to consider what is outside inside, but there is at the same time the opposite risk to feel what is inside as outside. So it depends on our personal story, it depends on the social environment, it depends on many things. And many times what happens is, for example, as I said before, in the panic attacks that happen nowadays, which are different from panic attacks of 20 years ago, for example, is that I have a little feeling, maybe my heart is beating faster, but in a not special way, or maybe my breath is a bit shorter because of a virus or whatever, or other things as it, or I feel a bit dizzy because I have low sugar, or my pressure is going down, or whatever. And if I'm not acquainted with my body, we say, okay, there is an explanation. I can understand that it is because of that. It's just that as if I'm menaced by my body. So what's going on? This strange thing that it's me, but it's not me. I don't understand. I cannot cope with. And so there is this strange sensation I cannot put anywhere. I cannot understand. I cannot make sense of that. And so it becomes more, because of course our mind is influencing. No, if we split body and mind, my mind is influencing, and so maybe the heart is beating even more, or my breath is becoming even shorter, and then it's as if and so maybe a panic attack develops, because I cannot make sense of what is going on. I'm totally afraid. I'm totally lost. And that's again about fragmentation, because our body, our acquaintance with our body has to be present at a social level. Myself alone, I cannot make sense of my headache. But I know that my grandmother used to say that when you have a headache or whatever, or maybe my neighbor, or maybe what I studied at university, they are all at the same level in this meaning. So if I'm in a situation in which I can find a meaning about what is happening in my body, about what I feel, I'm okay, I feel at ease with that. But if I'm totally alone, this kind of island, individualistic island I told before, and if the body is only a kind of medical body with, right or wrong symptoms and so on, so everything is just scary. And I need to, I don't know what to do. And I'm alone with this body, which is me and is not me, is also outside me and not tamed.
Venimos hablando de la construcción de los cuerpos y ahora de los sufrimientos. ¿Qué son los sufrimientos de los cuerpos desde esta perspectiva? ¿A qué se refiere?
Yes, you know, when we speak of psychopathology, which is more our general topic. If we speak of psychopathology, We know that from ethnopsychiatry, I would say, but it can be also totally part of Gestalt therapy without any problem, as we know that we are social made also in Gestalt therapy very well. And in psychopathology, ethnopsychiatry is considered as given by a kind of continuous negotiation among the patient, the client, the person suffering, the professional, and society, as if there is this three polarity. So we are always trying to say, okay, that is pathological, that is not pathological, how we can define that, and how we can heal it. So it's a continuous negotiation. Of course, the more society is fragmented, or for example, if we go to a totally different place to live, there is a lot about immigrants about that, because it's as if this kind of negotiation is interrupted, because it's not okay what we are doing here, and we are alone with our suffering. No one makes sense in the same way we are, and so on. So that is about psychopathology, and it's probably clearer and easier to understand it when we think of psychopathology, as it is something more ethereal, we think, but it's the same with our body. It's actually the same with our body, that there is a continuous negotiation about what is suffering, what is good or bad, what is also a healthy style of life or not, what is to be avoided or not. I mean, there is a lot of social negotiation and social construction about that. So that it is so much so that I mentioned before immigrants. For example, if you try to, and here is what we are trying to do, if you try to translate into a different language your symptoms, usually it is very difficult work, because we are used to think that it is natural, that is just, the body is natural, and so everyone can understand each other. But there are words or kind of diagnosis, way of saying, that are used in Italian and that are not present in Spanish, for example, just to mention a language which is very near to Italian. So if I think of Chinese or Japanese, I don't even, it's totally different. So, yes. So that is clear that is not something given, but that is a continuous negotiation. And of course, the way you define a way of suffering, then it conditions also the way you try to heal it, or what you try to heal, and in what way. So that is a very important process, and we don't often think on that, even as Gestalt therapists. I mean, I think we have all the instrument to understand that, but we don't usually, also in translating and so on, we forget that each language has its own black side, for example, or a black hole in some words or some concept that cannot be said, that a language should choose not to tell, or other language has different. So that's about also the physical pathology. And when I used to work with the immigrants more than now, it was so common that people came to us, so to the psychiatric, psychological, psychotherapeutic side, to speak of their physical symptoms, because when they went to the medical doctor, they were not understood. And so the doctor just said, "Oh, you don't have anything. It's just your mind, because nowadays it's like that. And decades ago, it was never, nobody spoke of psychosomatic symptoms, psychological side. But nowadays, at least in Italy, if you go to a doctor, most of the time they say, "Oh, it's psychological. Oh, that means you don't have anything." And it's not that I'm trying to understand what you mean when you speak of your way of suffering. What is the meaning you give to the words you use to express your suffering? And so there is a lot of confusion, and also of solitude, and also frustration on both sides, the client, the patient, but also the medical doctor. And with immigrants it's more clear, but actually we are all immigrants. I mean, we have all we have our own language, and so that's happening every day.
Bueno, si pensamos en el cuerpo como un proceso en constante devenir, ¿cómo podemos acompañar terapéuticamente este devenir de los cuerpos y sus experiencias de sufrimiento?
Well, another good question. I like your question. Usually questions are more important than answers. So it's very important. So first thing that comes to my mind when you ask that is that, again, going to the prehistoric time when I was trained as Gestalt therapist, as therapist, our master, our trainers, by the way, they were Giovanni Saloni and Margherita Spagnololo. They used to say that sometimes you as human being, you would need psychotherapy for each passage in your life. About the cycle of life, when you become adult, when you start your first important relationship, when you start working, when you become mother or father, when you become grandmother or whatever. I mean that when you stop working, I mean that in each passage there is a kind of, from one side I would say, risk, and from another side, opening of possibilities, as we know in Gestalt therapy about, excitement, growth, and so on. So when there is something new, some changes, that is the moment in which new shape can be taken, but also there is risk there, excitement and risk. So and so that is my first answer, or my first thought, that actually it is very important that to have the idea as therapists that it can be important to support. I didn't mention this word. I usually speak always of support, so now I'm mentioning it for the first time. It's very important to support life passages and to think of them when people come to therapy. So wonder, maybe there is a life passage there. Mostly nowadays, when we have to support so much personality function because it is not socially supported, the narration, the changing of the role, and so on. So yes, and in supporting that, we have to consider also the body, which I would say that we have to consider it any time in therapy. For example, as a psychiatrist, because I have also this dark side, as a psychiatrist, I usually get angry, of course, in a very joking way, in a way, when, for example, my supervisee say, "Oh, my client went to the psychiatrist and he is taking some pills," and I'm asking them, "What pills?" And they say, "Oh, I don't know," as if, "Oh, I'm a psychologist. I don't know anything about medicine." Yes, I know that you don't have to prescribe medicine. You don't have to know everything. But if a client takes an antidepressant, it's important that you know that he's taking an antidepressant, because it's part of the field, much more than other fields. So, and that is important also for other medicine, for example, or for some kind of chronic illness. It's very important that we know that, because it is part of the field of the life of our clients. So to have a kind of also medical anamnesis, I mean, without exaggerating, but to have present some part of that is quite important in therapy, because if not, there is a double risk. From one side, okay, I don't know, I push it away, I don't think it's important, and so on. From the another side is the opposite, to give too much importance. Because sometimes when we meet with it's a we psychiatrists, when we meet with psychologists, it's interesting how the we is changing all the time. When we meet psychologists, some of them think, "Oh, I'm not doing enough in therapy, so I'm sending my client to the psychiatrist, so the pills will solve it. I'm exaggerating now. They are not saying so much, but sometimes there is the idea, okay, if psychotherapy is not enough, maybe the medicine, the pills will support it. But it's not that. It's part of our process. I mean, it's important not to under-evaluate and not to overestimate the result or the effect of a drugs. And that is also about other kind of drugs. There are anti-inflammatory drugs that give you a kind of can give you a kind of maniac state, and so if you don't think of this kind of, you lose something. Of course, we cannot know anything. I'm not saying, oh, you cannot be the psychotherapist if you don't look that, but to have at least an idea that it's important to consider what, or if in my blood iron is very low, for sure I would be very tired. And maybe I'm describing myself as depressed, because nowadays nobody says anymore I'm tired, I'm sad, I'm with low energy. They are soon saying I'm depressed. So maybe a person is coming saying that he is depressed and there is low iron. So to think at least of the body, or even in a very simple medical way. I mean, without but also even with little things, to consider that our profession is concerned with the body too, not with abstract things, and not only with the body about feeling the body, but also with this kind of details which are not details about the body. I don't know whether I answer you or not, but
sí. Eso
we cannot think of the body as only biological, biologically made, but we have also not to forget it, that there is, and not biological in a very scientific or medical way, but as a body. I mean, as
right.
Something existing, taking the space and having, as I said before, rhythms and a lot of things going on. The blood circulating, hormones going around, digestive process. Immunity system, which is so important about the psychological side. Now we know about PNE, psychoneuroendocrine immunology, how much all this is connected, is influencing our mood, for example. So to think also that this kind of is a way, it was a provocation, of course, and you noted it, to put also this biological word, but it's a way to say that the body is embodied. It's not abstract, it's not only feeling, it's not only... And is embodied also in relationship. As I said before, the body is influencing other bodies. I mentioned some studies before, and for example, one study demonstrated that if you breathe the sweat of a person near you, of a person who has done a physical exercise in a high level, your body turns, or your sweat or your certain body turns as if he had the body itself had done some heavy exercise. So there is this, and we know that, for example, about women's cycle, that when there is the menstruation, the period, and you are in a group with other women, it's easy that there is a connection, no? And according to one. So the body are influencing each other, but they are but they are embodied, they are physical, they have biological. And we have to think of that. That it's not only experience in this way, but it's experience, embodied experience. Yes.
Interesante esa provocación. Para ir
And
concluyendo.
also, sorry, just maybe one more thing, because I didn't mention that, because it's part also of the building of the body and so on. Biological, it doesn't mean that, but we could involve into biological also the genetic side and the epigenetic side. Because again, sometimes we think only of the genetic side, oh, it is given, that is transmitted and so on, but that genetic is transformed by experience and can be passed to the following generation, also this kind of transformation. So there is really a lot of connection between body and mind, if we split, can say.
En grupos de formación generalmente aparece una pregunta muy interesante, que es, ¿qué se afecta primero, lo psicológico o lo biológico?
But it is a pregunta, it's a question that comes in the group. It's not a question that you are making me.
Pero también quiero saberla acá. A ver, igual sé que no hay algo primero, sin embargo quiero saber su opinión alrededor de esto.
Yes. I know. I was joking. Actually, what is coming first to my mind is, as I told you before, I'm working a lot with a colleague who is a proper medical doctor, not a psychiatrist, with Chinese medicine, and we work doing kind of psychosomatic, in a way, consultation, or more holistic consultation. I like it more. And there it's very interesting, because we are wondering all the time what is more than what comes first in the perspective of Chinese medicine is more what is protecting what. Because sometimes it seems, okay, here there is a kind of development of physical illness, and that is protecting your mental health. Some other time, yes, you are developing kind of stress, anxiety, or depression, but so you are not developing maybe some illness, maybe also heavy illness. So, and it's very difficult. There is, as you said, there is not an answer, but it's very interesting, this kind of balance. What is protecting what, in a way? And it's a perspective. It is very important to have. And then is what the other thing that is coming to my mind is one of the first things I told you when I said why I'm so interested in the body, about also psychopathology, because I think that field perspective support us also in that some psychopathological suffering are so deep, are so early, maybe in life, are so pre-verbal. That's why I'm mentioning field perspective. It's difficult to address them only in a verbal way, but even in our field perspective way, which is about resonance, about our body and so on. And sometimes it's just going to the body and becoming some kind of physical features or some kind of illness or some kind of, and so it's important also to consider that side. And sometimes I really, the more I'm working in this holistic perspective, the more sometimes I think that what is useful in a situation is, for sure, psychotherapy can work, but it's not even drugs, pills, psychopharmacological side, but it's maybe to support the liver, or maybe it's to support other parts of the lungs, other parts of the body. And that's a way also to support, because you feel there is something there. You feel that they are together, but you cannot address only from one side.
Bien. Hay una pregunta que también es interesante, ¿no? Y es el trabajo. A ver, el papel o el lugar del silencio en el acompañamiento terapéutico, sobre todo con las experiencias de sufrimiento, ¿no? ¿Qué importancia tiene el silencio?
More and more difficult, your question. No, well, it's not only difficult; it's always paradoxical to speak of the other side. Yes. So it's a kind of, yes, again, a kind of almost provoking or paradoxical. Yes, the silenzio. Oh, it's interesting. It's coming because in Italian it's silenzio. The silence is yes, is a very important part of our work. I would say that if we can stay silent with our client, that means a lot about our own support, because we have to consider that too, because sometimes for the therapist it's not so easy to stay in silence, but also about the support which is present in the relationships. So I would say that it's quite difficult to cope or to work with the silence at the beginning of a therapy. It's either that it is a kind of conquer or something that you arrive at a certain point. And the more you go, which is, by the way, similar to what I say about the field perspective. Sometimes, again, with our basic trainees, I say, yes, with normal client, I mean, not psychotherapists, they are normal. With normal client, you cannot start saying, oh, I feel that, so what does mean, and so on. You start explaining what psychotherapy is. You start trying to give them support, to acknowledge what they need, to explain that psychotherapy, yes, it is what they expect, even if it is a bit different, and so on. So you start working with more kind of normal tools, and not only in a field perspective, sharing disturbing feeling and so on. You can arrive there either, for example, I work a lot also in therapy with colleagues. So if I work with colleagues, of course, it's different. Or when you work for quite a longer time with a client. But also in supervision is the same. The more a supervisee is an expert therapist, the more you can work in a field perspective, and the more you can maybe stay silent for 10 minutes, because just feeling where you are, just making sense, just trying to feel, and so on. When you are with a younger therapist and anxious to know what to do with that client, you cannot do that. And so, but it's very important, and it's a conquer.
Claro. Bueno, me han encantado muchísimo sus provocaciones. ¿Qué tal si nos invita a los terapeutas gestálticos o nos da algunas puntualizaciones de cómo acompañar las experiencias de sufrimiento y la construcción de los cuerpos? ¿Cómo? Provóquenos otra vez.
Very, very good question to close. Yes, because here, for me, there is also the political side of our work. Not meaning political, I have to go to the government, but our kind of social role. So I think it's important inside therapy, but also outside, to be aware of that, to be aware of how the body is socially constructed, to be aware of our role in playing that, or our responsibility. It's very important, and I like the way you say to accompany the person, to support and to stay with the person in that. So for me, what is important, as I mentioned specifically when I speak of psychodrugs, is avoid to polarize, or support people not to polarize, because there is a lot nowadays about illnesses, about medicine, either to say, Western medicine is the best one, I only doing that, or on the contrary, that is all shit, and we have to do other things, and to really connect with our soul, and so on. Now I'm a bit joking, but I mean, there is this kind of polarization in which, again, there is a fragmentation, because one part of the fragmentation we were starting with is this continuous polarization in our work, which is exactly what Gestalt therapy was trying to avoid when it was born. So I think that our role there is that, about to try to support the backgrounds, to work about this fragmentation, to put the fragments together, which is, by the way of working in field perspective. Try to put fragments of the soul together, and that is also about the body, to try to build together a containment to different fragments of bodily experience.
He tenido muchas entrevistas excitantes, pero creo que esta ha sido la más excitante por ahora para mí. Así que muchísimas gracias por compartir con nosotros todo eso que tiene para dar y nada, totalmente agradecido y satisfecho con todas estas provocaciones. Gracias.
Gracias a voi.
Y bueno, un gran abrazo desde Colombia y bueno, espero en algún momento, como siempre digo, poder darle un abrazo a cada uno de los autores favoritos que tengo y en ese caso a usted. Así que confío y sueño en eso. Bueno, un gran saludo, que esté muy bien. Hasta luego.
Gracias.
Gracias.